Welcome back to Health Score. Today we're back in psychological health and we are talking about treating loneliness. There's a lot of recent evidence in the medical literature that loneliness causes increased risk of premature death. Now, how does loneliness cause health problems? Well, researchers consider two pathways to be likely. First is indirectly. So if you are lonely, you're more likely to smoke, be physically inactive, and have poor quality sleep. And then there's also a direct pathway and a physiologic direct pathway. People who are lonely are more likely to have increased blood pressure, increased C reactive protein, which is a marker of inflammation, increased LDL cholesterol, and a general poor immune function. In fact, research participants who had a swab that had the common cold on it stuck up their nose were more likely to get sick and develop a cold if they were lonely. Now, what do you do to treat loneliness? Well, there's two main pathways for loneliness. One is circumstances, like you don't have in your environment opportunities to engage with people. But the far more common reason that people are lonely is their belief about others. So they've had past experience, perhaps, where they came to doubt the intentions of others or became concerned about how they appeared to others, and so they avoid interaction. For this category, the recommended treatment is cognitive behavioral therapy. Cognitive behavioral therapists can help challenge those negative beliefs about others that can lead to loneliness. You can find a therapist by going to your insurance website and seeing who's covered in your network. And you can also check out this constantly updated list of therapists who have been recently reviewed by patients I see in my primary care practice in San Francisco. And all of these therapists recently have been doing video visits for patients. So you don't have to live in San Francisco to choose one of the therapists on this list. Now, the other reason people are lonely can be because they're not reaching out to others. And this can be complicated with shelter-in-place orders preventing people from interacting. There are still safe ways to engage in interactions with others and not risk COVID. So there's all forms of relationships. For romantic connections, a dating app can be helpful. And then arranging video calls, video dates, or phone call dates, or even being in the park with someone and wearing masks, meeting someone for coffee can be safe if it's done with both parties wearing a mask. For interacting with friends and family, there are many online platforms to schedule regular meetings and have someone to talk to. So we've discussed the relevance of loneliness to overall health and the importance of treating loneliness if you do feel lonely. We described how loneliness can come about because of our beliefs about others, and that can best be treated with cognitive behavioral therapy. And also, loneliness can result from just lack of opportunity to engage, and that can be addressed with several online apps and platforms, keeping in mind that social distancing should take precedent in any in-person interactions. I hope this video has been helpful, and thanks very much for your time. I hope you're able to treat loneliness and feel better.